Diabetes Connections is brought to you by OneDrop, created for people with diabetes by people who have diabetes. By Gvoke Hypo Pen, the first premixed auto-injector for very low blood sugar. And by Dexcom, take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
Welcome to a bonus episode of Diabetes Connections. I want to take some time and put this episode out quickly to talk about the new program from Beyond Type 1, getinsulin.org. If you are new to the show, I'm really glad you found us. Usually put the episodes out on a weekly basis, but sometimes we throw bonus episodes in here and there. My son was diagnosed with type 1 diabetes right before he turned 2, almost 14 years ago. My husband lives with type 2 diabetes. I don't have diabetes, but I have a background in broadcasting and local radio and television news. And that is how you get the podcast. And that's why this show has a little bit more of a newsy feel, a newsy type feel, than some of the other really wonderful diabetes podcasts that are out there. Now, earlier this month, Beyond Type 1 launched a new program. It is hosted at the website getinsulin.org. They say this connects people with diabetes who take insulin to assistance programs and low-cost solutions that match their unique situation. I was interested to learn more, and so I asked the CEO of Beyond Type 1, Thom Scher, to come on. Now, getinsulin.org is kind of a clearinghouse. I will link up to it, of course, in the show notes. The information has been out there for a while. These are coupons and assistance programs from the major insulin manufacturers, the only insulin manufacturers geared for people in the United States. As you well know, it's a complex situation. There really is no easy way to find out exactly what you qualify for, where to start. And that's what this aims to do. A lot of strong feelings online and in real life when this program was announced. Many people upset that Beyond Type 1 does take money from the insulin makers and that they have taken money and are putting the logos of the insulin makers on this website as well. And of course, I talked to Thom all about that. If you are looking for this information and you want the coupons, you'd like to go through and see, I can tell you before this interview begins, it really is a comprehensive website to help you find what you are eligible for. So go ahead, if you're looking, go to getinsulin.org and check it out yourself. I also need to mention the sound is just a little bit off on this interview on Thom's end. It sounds a little bit metallic. And long story short, that is my fault, my technical error, but it shouldn't keep you from understanding anything. It just might be a little bit distracting at first, and I apologize for that. Here is my interview with the CEO of Beyond Type 1, Thom Scher. Thom, thank you so much for joining me. I appreciate you making time to talk about this.
I am thrilled to be on, Stacey. Anytime I get to be on your podcast, it's a good day.
Oh, thank you. When we last talked, and I believe that was around the time of the partnership with JDRF when that was announced, you were already talking then about trying to do something about insulin access. So tell me a little bit about what getinsulin.org is all about.
Yeah, getinsulin.org was probably born right around that time, actually. It was over a year ago that we started talking about it. And really what we set out to do was build a one-stop tool that could get people to the right resources for them available today. And that's not only urgent resources in terms of emergency need, less than 7-day kind of need, but it really allowed people to get custom action plans that were based on their individual circumstances. So things like income, prescription, location, insurance type. And rather than get then a list of what is the, frankly, messy web of a lot of different options, they get the options that are actually specific to their circumstances. And we set out to build that and have it be a relatively easy to use and friendly tool for people that are in that situation, which we know is, frankly, far too many people.
So how does it work? I mean, it's easy to see. You can get on it and click around, but I'm curious to hear your words. How do you explain it? What will people find?
At its core, what we ask of you is a very small subset of information out of the gate. I believe it asks you for zip code. It asks you for what specific insulin you're on, both brand and dependent, maybe the product itself, pen or vial, et cetera. And then it asks you what insurance type you're on. And at that point, the system starts to essentially tree out. So if you're on commercial insurance and, for example, on certain products from certain manufacturers, we're good. We have all the information we need at that point to tell you, for example, a copay card could be eligible for you based on what you've told us. But if you say you're on Medicare, we're probably going to need additional income elements. We may need to know if you're on no insurance, whether you were laid off as a result of COVID. Those kind of questions come up in the flow as we work to essentially filter out the things that aren't relevant to you. So what you get at the end is just the specific programs that are relevant to you. I want to be clear, we're not acting as an actual assistance program. What we're doing is essentially eliminating the guesswork that's gone in for far too many people at this point in time of not knowing which programs they should be going to in the first place. This project was born out of stories about just that, where we'd hear, frankly, these harrowing stories of people taking a day off of work, going into a clinic, being told there might be a program available to them, filling out an application, having it sent in, only to then be rejected, not knowing that it's because they'd applied to the wrong manufacturer or the wrong program within a manufacturer, not knowing that they were actually Medicaid eligible, those kinds of problems. And they kept happening. And for me, that's an awareness and routing issue. And I want to sort of double down. This is far from systemic reform here that we're talking about. But what it's doing is offering a tool to those patients and, frankly, the providers that are helping them ensure that they're getting to the right place out of the gate.
So it's like a clearinghouse. You know, we've seen those piecemeal posts here and there. Lilly has this, Novo has this. You can apply if you've lost your job. This is a place where you go and put a little bit of information in and narrow it down through all of the assistance programs?
Yeah, so it includes programs from Lilly, Mylan, Novo Nordisk, and Sanofi, as well as various government assistance options. In particular, your state Medicaid programs, as well as Medicare information and CHIP information, depending on state. And all of that is essentially aggregated. It also includes patient assistance programs and commercial programs. So that includes things ranging from copay cards on the commercial side, for example, or cash programs, and also the actual patient assistance programs. And that's important because it's another area where patients had a friction point. Because, as we all know, if you call the Lilly Solution Center, they can't help you with your Novo Nordisk product. At the same time, if you apply to the Lilly Cares Patient Assistance Program, you may not be getting information about what you could be getting from the commercial side. There are all sorts of bright lines that, frankly, are set up for regulatory reasons. And that's fine. But by injecting a nonprofit in between, we were able to create a one-stop clearinghouse, as you put it. And that's a really good way of thinking about it.
What happens to the information that I put in to be on type 1?
It vanishes.
It vanishes.
It vanishes. Stacey, it's a great question. It's plastered all over the site because we get it a lot. Everything you're inputting is done browser side. Nothing ever communicates to our server, with the exception being at the end if you decide to email the substance of it to yourself. And at that point, we use it for very strict purposes, and that is to send it to you and then purge it off of our servers as well. So we're only looking at the data in aggregate, traffic, location of that traffic, and then generation of action plans. So the number of people that are actually getting to an action plan itself. But outside of that, we don't retain any of that information. It's actually a real point of concern, in particular for often the people who need these programs most. It's also a fear that we're just passing marketing information, for example, along to a manufacturer, and we're very much not.
I'm curious about how the conversations went, because I imagine there were some people in the room who were like, we need this. We got to capture this information because that's what everybody does on the web, right? I mean, when I put out my book, I was shocked when my website people were like, oh, you got to capture every person who buys it and does this. And people opt in. But at the same time, it's stunning how much information you can capture if you want to. Can you give us a peek into those conversations?
Yeah, I think that there's always a give and take in those conversations. And for me, it stems from the goal of what we were trying to accomplish. Seamless, rapid information to actual people in need. And in that case, I don't need to capture that information. And in fact, I don't want to. It can slow the process down. And frankly, it adds a layer of this serving as some kind of weird marketing output that was never really meant to be. The entire premise at the get-go was, look, there are people who don't know what options are available to them, and this is for them. At the end of the line are real people who do not know which programs are available to them. And I want to add, it's unfortunate that that's the reality here. It shouldn't be on individual people to have the level of health literacy required to navigate the system. But that's the system we're in. And if we can reduce any of that burden, then that was the goal at the outset. And so I think the really honest answer to your question is I had no tolerance for those conversations in the early days when we started building this thing.
I have to ask you about the elephant in the room, which is, and we've already seen criticism online and elsewhere, that there is money changing hands here, that Beyond Type 1 is taking money from the insulin manufacturers to put this site up to drive people to the insulin manufacturers. To be very clear, what is the relationship? Did the insulin makers give money to have their logos and their websites as part of this? And separately, to acknowledge that Beyond Type 1 has taken money from these manufacturers in the past.
So first off, yes, we've taken money from the insulin manufacturers. It's disclosed on our funding model page, and we're clear about that and want to maintain high degrees of transparency on it. It's right on the top of the website. On the website itself, you get there, it's on the homepage. It says it was funded by the 4 manufacturers. This kind of a project is complex. And frankly, having that many manufacturers on a masthead along with the partners of sorts that we do is a hard set of cats to herd anyway. But in this set of instances, what we needed was funding in order to be able to build the site or maintain the site, in order to get awareness out about the site. And the tool itself is pretty powerful on the back end. And I'd love to get into that a little bit more, but in terms of what it can do moving forward, because there's a lot more that I think we're going to be able to do with it. The other thing, though, is that we frankly needed a working relationship with the manufacturers in order to understand the nature of some of these programs, really get a look under the hood at all of the edge cases, all of the one-off instances in one-off states where there have been, for example, copay caps passed or various laws have changed the eligibility of programs, understand the dates when those programs reset annually, understand changes in eligibility to them, and build a working relationship that will allow us to also maintain that accuracy on the site itself so that we're directing people to the right places. This information, one of the critiques has been it was publicly available. And there were a number of organizations that had big lists. We were one of them. BeyondType1.org/get-insulin for the last couple of years has aggregated this kind of information. But what it hasn't done is have the degree of eligibility clearing that you've described as a clearinghouse, rightfully so, that this tool does, where we're really able to get in there and say, hey, based on what you've told us, we believe you're eligible for this program. You're going to have to go to the program to confirm that. But that is so much more effective, having been able to actually work with the manufacturers themselves and have that working relationship to not only ensure accuracy at launch, but accuracy and awareness of the tool moving forward.
I think there are some people in the community, though, who would say we shouldn't be working with the insulin manufacturers. We should only be fighting with the insulin manufacturers because the prices are so outrageous and the situation is so dire. Obviously, you disagree with that. Can you address that?
Yeah, I think it's right for patient advocates to question the relationships held by patient advocacy orgs and frankly advocates anywhere. I don't think that's a bad thing at all. And I respect whose view is that you shouldn't be working with insulin manufacturers in the diabetes space. I do disagree. I think that it's important for us to have a working relationship, not only to be able to fund critical projects that can have a meaningful difference in people's lives, but in addition to that, to have a working relationship and a seat at the table to help drive change forward. I think that some of this critique comes down to if we're working with them, will we critique them? And, at launch of this, we also published an open letter of sorts from me where I'm very direct that I believe it's unacceptable to see list prices having risen the way they have. I'm very direct that I think it's unacceptable to see rationing where it is. It's unacceptable to have the rebate system how it is. But none of that for me trumps what is the importance of getting this out to the people who need it and having the support to be able to do that. And I'll add on this, Stacey, you don't launch something like this in this day and age with insulin manufacturers about insulin and not know that that critique is coming. We, of course, knew that critique was coming. We launched this in spite of that knowledge because we believe that downstream are actual people who need the tool. And that came out over and over again over the course of building it and has come out over and over again since launching it. It in no way means we're giving up on the upstream fight. And in fact, that upstream fight is a much harder, much longer road. And it's a road that we absolutely believe in. We believe it definitely needs to happen, but it's not as simple as asking for list price to simply be lowered. In fact, there's quite a robust set of evidence now to the contrary of that. So I respect that view, but I disagree with it.
I'm curious, we're talking really days after this has launched. Have you heard from people that it's helped?
Yeah, I have. A member of my team said to me when we launched, and it's some of the most sage advice I was given about this, that launch day was going to be about hot takes. We were going to see hot takes from people that were critical of it. We were going to see hot takes from people that really thought it was impactful. We were going to see patient stories about these programs working or not working for them. We were going to see industry leaders and sort of key thought leaders having strong opinions about it one way or another. And that at the end of the day, none of that really mattered compared to the stories that we hoped would emerge about people actually using it. And we're starting to get some of those stories. And I was just reading one in my inbox from a partner at an org who sent us that they had walked somebody through it over the phone, and that they'd gotten a phone call asking for help, and that they'd taken them to the site and walked them through it, and that it worked for them. We also had a conversation with, and we're doing some work with Dr. Ann Peters, who's on our leadership council, and she just had glowing things to say about its use case in clinic. And we saw a lot of that kind of commentary, that this is going to be a really powerful tool for providers to weave in. And so, yes, I think, far too often in the diabetes space, I think we get lost in some of the higher level talking points about why and how we're operating and whatnot, when all the way downstream are just people trying to, frankly, manage their diabetes, live the best lives that they can, and get through their day sometimes. And that's a huge volume of people. And I think this tool, more than anything, is for them, not for the hot takes by myself or you or Twitter or industry. Kind of none of that matters to me by comparison to whether or not people are actually using it.
I'm curious, too. It also says in partnership with some groups that I'm familiar with, but I haven't seen in conjunction with diabetes issues before. Feeding America, the NAACP, the National Hispanic Medical Association. Tell me a little bit about reaching out to those groups and why it was important that they get on board with something like this.
It was critical to me. It spoke to what we were trying to do. I remember the Feeding America conversation really clearly, the first one that we had with them, and they're phenomenal partners. And one of the things I'm really excited about with the tool is that we're going to add some food security information in terms of how to find local food banks that's based on some of the information that we're getting. And that's coming likely in the next week or two. With Feeding America, one of the critiques that I think is so often dead on when we talk about helping those who need the help most is that people will say, well, look, doing Facebook posts about insulin affordability isn't really helping those that are sitting at a pharmacy counter somewhere, not understanding how they're going to pay for insulin, not knowing what options are available to them. Feeding America is on the front lines of the equivalent of that when it comes to food security. And they know what so many of those community health struggles really look like. They had tremendous insight for us into how we built this, how to get it out. And it gives us a direct mechanism to drive awareness of the tool in groups that may have outsized need, these underserved communities. NAACP is the same way. NAACP has a robust health arm, and they think about the best way to serve those who need support. And, they obviously deal with that through various lenses, but we were honored to have their support and NHMAs and Feeding America. I think it speaks to the idea that this issue is one that frankly transcends the diabetes conversation. This is so often about the people who are impacted by diabetes who aren't part of those online conversations. They're not part of camps and events and summits and the like, but they're absolutely impacted by the disease.
Yeah, I worry about that too, to be frank with you, because, my podcast audience, as you listen to this podcast, these are some of the most well-informed, most engaged. These are people who may have the time to listen to a podcast, who know where to find information. So to hear this push to try to get this info to people who might not be on Facebook, listening to podcasts, that just makes a lot of sense to me.
Yeah, look, I also will add here, I think that the ask for your listeners isn't that they perhaps need it, although I encourage them, go play around on the tool, see what it gives you. Let us know if you see anything that we can do to improve. But more than that, it's about sharing it. And I think some of the things that our team has been most touched by have been people who've shared it with even the equivalent of, hey, I may or may not support Beyond Type 1. I may or may not need this tool myself. I certainly don't believe that this tool should have to exist in the first place, but I acknowledge that it needs to. And there might be people who follow me. There might be people in my network who do need this tool. And so I'm getting it out there for them. And that resonates with me so much because it's the only way that you can get necessarily to people who really need it is through conversations like that, partnering with those on the ground that are really doing it and making sure that it's getting into the hands of the people that are actually not only using it, but working with the people who are using it.
Yep. I like that idea too of sharing it with a physician, sharing it with your endo or your general practitioner who may not know anything about Beyond Type 1 at this point, and then to have this for other people who may need it as well.
Yeah, Stacey, I'll add too on that. There's a reason why we housed it at getinsulin.org. It's not some brand play for Beyond Type 1. I think that for us, if this was some kind of traffic play and the like, sure, those critiques are a lot more appropriate if we'd launched something and driven a ton of traffic to the Beyond Type 1 site with a bunch of click through. No, it isn't what we did here. We tried to build this thing so it could be standalone and independent with a strong coalition of both diabetes and non-diabetes partners, and frankly, a ton of touch points offline to ensure that this gets out there, which we're doing. I'm doing this podcast, but there's also radio ads happening in certain places and digital marketing happening in certain places. Yeah, we're doing a lot of targeted work over the course of this quarter and into 2021 to make sure that this is getting to the right places. We just sent print versions of awareness materials to a ton of clinics. So this has a lot of tentacles that we haven't talked about a ton because it's all part of what is a much bigger strategy around how to ensure that this gets out there to the right people. And the diabetes audience that you have is a core part of that, of course.
Thom, before I let you go, and you may not be able to answer this, and that is fine. We're talking at kind of the peak of this incredibly historic, bizarre, I don't know what kind of words you want to use to describe it, election year. I know I'm not going to ask you about politics, don't worry. But I am curious, are you optimistic that we're going to see a progress on actual insulin pricing and changes? I feel like the last couple of years, even with the hot takes, as you say, there does seem to be a groundswell of, if not support, maybe just better education among the public. I'm a little bit more optimistic than I used to be. And I'm curious if you are.
Stacey, I don't know what you're talking about. There's an election and 2020 has things going on that are crazy. I am optimistic. Look, I think the reality here is that the system is very broken. And we all know the system is very broken. The unfortunate reality about diabetes is that it's not that it's diabetes broken. It's that diabetes is the poster child for how broken the system is. And that means that we believe the answer to that is regulatory reform. It's actual legislation, federal and state. I agree there's been a groundswell, and I credit grassroots activists for that. I credit the work of a number of organizations for that. I credit a handful of politicians on both sides who've done work in this arena. But we are hopeful. I think that we're starting to see policy proposals that make sense, that are gaining traction. Do I think we're going to have it immediately, all of a sudden on one day? No, I think this is going to take time. But I think we all know that with time, this issue is going to only get worse unless more is done. So I am optimistic, despite what is a relatively sad view on the reality in terms of the state of affairs.
Well, thank you so much for joining me to explain this. I appreciate it. And, we'll check back. We'll see how things are going. And I do appreciate you taking the time to address the criticism and to explain the program. Thanks, Thom.
You're listening to Diabetes Connections with Stacey Simms.
As I mentioned, of course, we are linking up at diabetes-connections.com in the show notes. And there's a transcript there, by the way, as well. We do a transcript for every episode in 2020, and I hope to kind of go back and put more in. I've been doing this show for more than 5 years and more than 300 episodes, so there's a lot of transcripts to go back. But I think it's really important that you get this information and that if you need the assistance, that you get it. I would love to know what you think now that you've heard Thom speak out. I'm sure many of you are still quite upset. He addressed the issue about taking money from the insulin makers. Doesn't mean that you have to agree with it, but I'm glad that he came on and explained the stance of Beyond Type 1. I also want to add that I'm going to be doing an episode or a social media post or something to get some information out. So as they say, watch this space, because I have a personal story and I have a friend with a personal story, and we are both going through some difficulties using specifically, not to single them out, but whatever, the Lilly coupons. And as we are navigating through this, I am kind of waiting for the situation to resolve, to share the information and what we've learned with you. So I really hope to bring that to you within the next week. But I will say there were two separate issues here. One, the annual cap that Lilly has, that all the manufacturers have, and how to get around that. And the second is, why would it be difficult to use the Lilly coupon when you have commercial insurance if it tells you that you can? So there's a lot going on. Anyway, more information, as always, at diabetes-connections.com. Follow us in the Facebook group at Diabetes Connections, the group, or on social media, me, Stacey Simms, and I'll keep you posted on those two personal stories, one of which is my own story about using the Lilly coupons. Thank you to my editor, John Buchanan from Audio Editing Solutions. Thank you very much for listening. We will be back here on Tuesday with our regularly scheduled episodes. I will see you then. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.